Country roads, take me home to the place without COVID-19. West Virginia, Mountain Mama, take me home. Country roads.
Okay, that's enough singing for now.
Okay, now, so
okay, let me explain. Were you wondering why these two sang that? Well, coincidentally, 98% of the United States has the coronavirus right now. And can you guess which state doesn't? Well, coincidentally, West Virginia.
It's the only state out of all 50 that does not have any coronavirus.
Alaska, Montana, and Idaho.
And
got it before.
Wyoming's more surprising.
Yeah, well, Wyoming got it, they got it not early on, but they got it, they were the 45th, maybe, state to get it?
Or and 44th? Meanwhile, West Virginia is, borders, Maryland, all these busy places, and just, apparently no one goes there, so no one has it yet. It's kind of surprising, actually. But I guess it's mostly rural, so maybe that's why, but it's pretty interesting. And
it wasn't even the biggest place
we apologize for our intro, but I think it was
a
beautiful moment.
It's beautiful.
It was beautiful.
Yeah, because there's 26 confirmed cases in Maryland.
By the way, this video is not sponsored by West Virginia Department of Tourism, who's trying to get people to come there because it's coronavirus free.
And District Columbia has 10. So that's
really?
30. That's 36 within at least a 25 mile. I don't know how many actually.
It's pretty close, but
and these are statistics from the New York Times, just so you know.
Yeah, and it makes sense that a lot of places that have a lot of international travel have some cases.
Yeah,
and it even makes sense. It makes sense that President Trump came in contact with some people that had it, even though he probably does not have it. He's not showing symptoms. So.
Both a little and less surprised that Italy got it first, because I think Italy is probably one of the most touristy places, because Venice, Rome, Milan, just, there's a lot of touristy places in Italy, but they shut down the entire...
Pompeii. Yeah. Oh, so for example, it's been the first... Okay, I saw a really funny tweet, actually. So someone posted, they were in Pompeii, which, is the place that was destroyed by the volcano, and they said, this is the first time I've ever seen... that. I think this is the first time that there's been no one in Pompeii, and then someone replied, well, there was at least one other time.
Oh, Jesus. Oh, jeez. Alright. Yeah, so Italy's a bit... shut down. Not a bit shut down. It is shut down.
Completely quarantined. No one can leave their homes basically.
Was there another European? I feel like another European country I heard was shut down.
It's mostly Italy. There's some cases scattered throughout Europe, but
there are.
I mean, actually, I can pull up the numbers.
There's already been a lot of public places canceled.
Donald Trump banned travel to and from Europe. Now he's
actually from Europe, not to Europe.
Oh, only from?
So technically, you could go to Europe, but you just can't come back. So that's probably not a good idea.
Yeah, but now he's banned from the UK and the Ireland, and not the Ireland, but from Ireland now. So that's
yeah. Italy has, as of Saturday the 14th, they have 17,660 confirmed cases. Iran has 12,729.
Oh wow, that's up from the numbers I have up right now.
And both Spain, Germany, and France all have over 3,000 cases. Spain has over 5,000.
South Korea has over 8,000.
And they do.
Yes.
The scary thing is that...
And I think the biggest increase is obviously Italy. They, within the last couple days, or last day or so, I'd say, Italy, again, is at 70,660, and their new cases are the highest at 2,547 up.
From yesterday?
Yeah, new cases.
That's a big deal.
And total deaths are at 1,166.
In Italy?
Yeah.
Yeah.
And the U.S. Has 50 deaths?
Yeah. And 2,345 confirmed cases.
Again, yeah.
Yeah, so it's a little bit up from your thing.
Yeah, these numbers are a little bit outdated, but it's constantly...
And it's rising at almost...
I mean, these are the most updated numbers from, the New York Times.
Yeah.
And the interesting thing is, if you look at what the curve is, and you see those graphs where it's what will happen if we don't take preventative measures, and what will happen if the U.S. keeps doing what it's doing to prevent things, including pretty drastic measures like closing schools until the end of the month in some states. Basically, we're going to flatten out to where the healthcare system can barely deal with it. But if we didn't take preventative measures, the hospitals would be totally overwhelmed because they don't really have a lot of extra beds normally. So that's kind of the thing is, the government has to take these steps, including the travel ban thing. That actually makes a lot of sense in this circumstance. It's really necessary to stop the spread.
I would like to acknowledge the fact that we are all here despite not being 6 feet apart and despite being quarantined.
And yes...
Well, we're not quarantined.
No, we're fine. But
So I think...
I had a massive discussion this morning between not so many people, but, members of my family and you two, because I was, everyone brought up good points about, like, the virus is in its nascent stages, and it's only going to get worse, as you said, Nick, which is I think is most true. So I guess we decided, take preventative measures, clean the house,
wash your hands,
disinfect, wash your hands consistently. Please do that. Please wash your hands. If you're not doing that, you're doing something wrong.
Yes.
Yeah, that's
even
like
after the coronavirus, that's an easy preventative measure. You can just do it all the time. Go to a sink, pump some soap, wash your hands.
Yeah. But there's also like a balance that needs to be struck. So like, so there is a degree to which you need to be worried about it.
Correct.
But people that are going and buying, like 10 weeks worth of toilet paper.
Oh yeah, that's
and
too much.
are considering, the most extreme measures. That's probably not what you should be doing.
So yeah,
and I think that also brings up an issue that people are only. I'm not saying people
overreacting,
selfish, but overreacting, but also make sure that other people have enough. Because I mean, if you're taking like the entire stock of toilet, I'm not accusing anyone, but I'm just creating a stereotype or idea that if an individual is taking the entire stock of toilet paper or the majority of it, you're not leaving enough for everybody else, because everybody else has to be clean.
The problem is that it's hysteria. No one's going to run out of toilet paper if you bought a normal amount, but because some people are hoarding things, the stores are having a hard time being supplied, even though there's really no shortages. We have a totally normal amount of everything, besides maybe some imports from China or something. Yeah. But really, we're completely fine, and people need to stop freaking out. I saw on Facebook earlier that apparently the Walmart in Villa Park is out of soup. Like, all cans of soup.
My gosh.
And someone posted a picture of just completely empty shelves in the food aisles.
So I've seen so many empty shelves. Constant lines. I mean, it's...
Yeah, and I saw a really funny one where it was the entire pizza section was bought out except for, like, the broccoli and kale pizza. No one bought that. So, like, there's some kind of funny stuff happening because even people don't want to touch that. But, like, but people are freaking out. Stores are basically completely bought out of a lot of things. And a lot of it's due to hysteria. People don't need to freak out. If you have a week's worth of toilet paper, you're fine. You don't need to, like...
And you also need to, like, heed recommendations. So, like, read the CDC's website and don't engage in rumor mills. That's so I know Mr. McGuire at York came on and talked about it and was like, hey, we can't engage in rumor mills. But that's really true. Because there's a lot of bad, this is a really bad situation, obviously, and there's a degree to which we need to take it seriously, and there's a degree to which we need to not overreact. And if we're constantly posting about things that aren't necessarily true, then we end up feeding into hysteria. That's going to make the situation worse. It's not going to make it any better. And so before you, talk about something, make sure you're talking about factual statements. That's why when we were reading off the number of cases, that's why we were reading it off of confirmed sources. Like the New York Times is a reliable source. It's getting their data from, state governments and things like that. And it's important to do that because if you don't, you run the risk of potentially, creating mass hysteria. So just be mindful of what you're posting. Be mindful of what you're saying, and also be prudent about who you're talking to about certain things. Because there are certain, if you're talking to somebody and they might be sensitive to the subject, or they might not want to talk, because it's stressful.
It is. I'm scared. I mean, I'm not like scared to death, but still scared, Yeah.
It has made me stressed at certain points, and so I think it's important to recognize, to be there for other people when they need,
and do help people if they need it. Because I heard a story, they're not here, but just across the interwebs, of an elderly couple who was not stuck, but sitting in their car at a grocery store.
Waiting for someone friendly. It was on Twitter, right? It was a girl that posted on Twitter.
I think so, yeah.
So they were waiting for someone that looked friendly to, like, get them stuff.
Yeah, they were waiting in their car. They gave a girl who was nice enough to help them because they were scared, because elderly people are probably the most, not immune, but most vulnerable.
Yeah, I was going to say, immune is like the exact opposite of
that's what I meant, not immune. Yeah, opposite of immune. Yeah. The most vulnerable with not compromise. But yes, people with compromised immune systems, but also people with kind of weakened immune systems, might I say. So, although I think we have the least chance of getting it or at least dying from it as Gen Zers and, teenagers, we can be carriers of it.
Yes.
So be cautious. Although you might have symptoms, that doesn't mean you can't carry it.
Well,
just be cautious.
Kind of, but the problem with the COVID-19 thing is, in a lot of young people or people that are healthy, it's just going to act like a bad case of the flu or something like that.
Exactly.
It's basically just a lower respiratory illness. A lot of people do not have to go to the hospital at all unless you have previous breathing problems and things like that.
Yes.
And the problem is that it's highly contagious and some other people can be more susceptible. So really just don't be selfish. If you have symptoms, just don't go out in public. Stay in your house and you will be fine. And maybe ask your doctor what you should do. But
if you see something that you're not sure of, fact check it.
Also,
because I've run into 3 instances where I believed all 3 of them, and then later I saw a publication by the CDC which dispelled all 3 of those, which are myths. And I'll tell you what those are.
And you definitely
it's that breathing exercise, quote unquote, that you can do, like to hold your breath for 10 seconds, and if you have any trouble, you have the coronavirus. That's false. That's completely false. Holding your breath for 10 seconds won't tell you if you have the virus or not.
Yeah.
There are symptoms that the CDC has listed, and those are these symptoms.
And also,
another myth is that the coronavirus is resistant to heat. That's again false.
Yeah.
And again, taking a hot bath will prevent it. No, that's false. Coronavirus will get anywhere.
Yeah. So and I mean, even like to the thing about people think that just like the seasonal flu, it'll go away over the summer. Potentially, that's true.
Maybe
to some extent that happened during the Spanish flu, but it's important to realize when October picked up, it kicked back in. It didn't just disappear.
To be fair,
and
though,
it started killing hundreds of thousands.
My dad, who, he's an emergency room doctor.
Oh, you have a dad?
I have a what?
Sorry, I was not watching what I was saying.
No, it's
go ahead.
Regardless.
Go ahead, Nick.
Yes, I have a dad.
Continue talking.
And he's an ER doctor, which is kind of on the front lines of this. He's going to have to eventually test people when it comes to wherever hospital he works, which is kind of in the rural area, but. But basically, he said it probably will die down a lot in the summer, and his analysis is that there's a lot of preventative measures being taken. We will be fine. It's not going to be like the worst case scenario is this one scientist said something along the lines of like 1% of the population is going to like 50% of the population is going to have it, and since it has a 1% death rate, that's a lot of deaths. But because we're preventing it so well, I think it's going to kind of plateau eventually. In the summer,
but
it doesn't have to do with the weather too.
Yes. But even though it may die down, I would advise to continue taking these preventative measures of washing your hands, staying clean, and also in general, stay clean.
If you have symptoms, you should get tested because that's really important for public data.
Yes, it's important because it could it be just the general flu? Yes, but also is it important to differentiate and tell the difference between and kind of double check to make sure it's not the or it is the flu and not the coronavirus, or vice versa.
The reason that the government does not freak out about the flu every year is because it's not as contagious and doesn't have as high of a death rate. So in last year, I believe there's about 28 million cases of the flu and 44,000 deaths. 44,000 deaths is a big deal. There has been nothing close to that in the U.S. It's like you said, it's like 50. But the problem is that that's a much lower percentage death rate than the coronavirus. If there were to be 28 million cases of the coronavirus, that could be like a few 100,000 deaths. So
it depends on your age.
It depends who gets it. Yeah,
it depends on your age group.
But overall, it's a large sample size because people of all ages can get the flu.
Yeah.
So,
but I mean, like if you look at, for example, like the difference between who's getting it, who isn't, it seemed like the Spanish flu, for example, did not like differentiate between old and the young. Spanish flu was deadly around basically every single population. Which I was reading an article, I believe it was in the New York Times, about that was written by some doctors, and they talked about how the coronavirus is different in that way, that it does seem to be affecting disproportionately older populations or populations with pre-existing conditions, and so that obviously is important to take into consideration for us, so that we don't have to be too worried about it. People that are our age that are worried about dying should probably relax a little bit. We're probably not going to die.
Yeah, probably not.
No, but it as we keep saying, it's important to take these preventative measures and what they're referring to, and there's a reason to believe it works because we're using the Spanish flu as an example simply because it's probably the most comparable case in recent modern history. Even though
it was over 100 years ago.
I mean, yeah, it was 1918, but St. Louis ended up closing all schools, closing public events, and taking extreme preventative measures to prevent the spread of the Spanish flu back in the day. And they actually saw less cases spread around the city, as well as fewer deaths in comparison to other cities.
And we have so much more advanced knowledge of medicine at this point, and the government can do a lot more. So I think that things
the government needs to do. I think,
yes, a lot more. I think it is going. The government's response is adequate. The CDC director has been there for a long time, and he seems like he knows what he's doing. So
yeah,
I think, and they have a big team of people working on it. Mm-hmm. And it's only a matter of time before I think there actually is a national state of emergency declared.
Yes, there is. Be careful what you touch, because I think it was like a basketball player. Some of you probably know his name. I don't. But I saw a clip of him, and he was like at not a meeting, but like maybe a press event or press conference where he was surrounded by like all the microphones, and he was sitting down, and then he got up, he literally touched and got his hands all over the microphones as a joke. And then later, guess what he got? He got the coronavirus. And then I'm not saying anyone's gonna. I mean, maybe some of our officials may get it, but what was it? Trump? Yeah, he even after the thing, he was shaking everybody's hand. Like, you really got to be cautious.
So it is starting to impact kind of our lives because the schools are being closed and things like a lot of public kind of stuff is being canceled. A lot of concerts are being canceled, which is disappointing to like me because I was planning to go to a concert, and stuff like that. Yeah. And also the entire March Madness tournament was canceled by the NCAA. And
MLB, NHL,
yeah, and the disappointing thing to a lot of people that watch March Madness, like my dad, is that they were planning to just have no audience at all and just test all the players before they started, and a lot of people think that's a good idea. There's really no risk of anything. There would just be a couple refs and the players in the room, and they decided to not even hold the tournament and completely cancel it, which is disappointing to a lot of fans. So sometimes they're going a little bit overboard with the measures. But it's probably for the better, actually, in the long run. Even though there's very few people that are going to be there. That's the problem.
And I also think one of the things that kind of is like happening throughout this whole situation is, with all these closures and things like that, especially of major public events, like, as you're saying, concerts and stuff, I think the biggest thing that really people in the United States have to worry about is the economic impacts of what's happening.
People not being able to afford childcare because school's canceled.
Precisely. Yes. Or people not being able to work. And, that's really what's going to be driving there's a lot of fear right now about, in terms of how people are going to work. Now, luckily, for example, in the district, our teachers are going to continue to be paid because they're salaried employees. They're obligated by a contract to be paid. And so they don't have to worry. But other people that are not, contractually obligated to be paid, if they, minimum wage workers, if you work at, a Starbucks or a McDonald's or something and they close down, that person is not getting pay. And
if people that are living paycheck to paycheck have no path.
If their job shuts down, there are risks and there are reasons to believe that potentially we could be headed into a recession. And that arguably could be worse for the long term than...
There was indicators of a recession before the whole coronavirus thing happened.
Oh yeah, they were predicting.
But when all of this hysteria began, and it's being impacted by real problems like trade from China is significantly slowed or cut back, and the Dow had dropped like over 1,000 points.
Oh, it's dropped. It's dropped like nearly 7,000 points. It's up
crazy.
2,000 today, and
yesterday.
Yesterday, yes.
Because the market's not open on Saturday, but on Sunday.
And the government injected like $1.5 million into a stimulus package. Trillion, I mean. I meant to say trillion. $1.5 trillion into an economic stimulus package. But it is kind of interesting that the government's doing that when someone also had mentioned on Twitter that that's almost the price of what it would be to forgive all student debt in the country.
Huh.
So
it's a huge
and most of it is just to help like stockholders. So looking at priorities a little bit,
Yeah.
And it was an economic thing. It was not to prevent the coronavirus.
And I will. I know some people are going to hate me for saying this. The president has not done a good job of talking about this at all.
Yep.
So when he gave his address a couple nights ago, he made several inaccurate statements. He doesn't seem. He seems more pressingly impacted by trying to prevent the virus from being blamed on him.
Because he might not be reelected because of it.
Yeah, because it does pose serious reelection threats. The economy is his strongest selling point.
And now it's not as strong
anymore. And if the economy does go into a recession, it's pretty hard George H.W. Bush, after winning a huge victory in the first Gulf War, people thought he was going to cruise to re-election. But the economy wasn't very good on election day, and ultimately a lot of Americans end up voting their pocketbooks.
For Clinton.
Yeah, and so they ended up voting for Clinton. And so there's a risk for Trump that obviously, he's concerned about that, but he does seem to be trying to downplay to a significant extent the extent of the virus. He talked about how it's, at certain times he said that it's already under control in the United States, which it absolutely is not.
Yeah.
And, he talks about how vaccines will be ready in months.
That's not true
at all.
It's a year and a half.
Yeah, a year to a year and a half is what most experts believe it's going to take to get a vaccine out. And making misstatements like that, not knowing, those things, it's dangerous. It's dangerous for the American public. And
yes.
I think it's leading to more confusion and more like people don't really know what's going on.
Exactly. And the problem is that I do not trust President Trump on any kind of scientific issues.
Mm-hmm.
For example, a few years ago, in 2014, he stated that basically that flu vaccines, or not flu vaccines specifically, but he stated that vaccines cause autism when too many vaccines are given at one time to children, which is a total conspiracy theory. It's repeatedly disproven by all scientists. And so that's a statement that's really harmful to public health, because that's the kind of thing that causes things to be vaccine skeptical, and which causes herd immunity to be lower. So statements like that really make me question his scientific knowledge, which I believe are very minimal, on a lot of other like environmental issues as well. So I will say that I'm glad that we have other competent people within the government that are handling the situation. At the very least, Vice President Pence does not appear to be incoherent, and he's addressing things fairly well. But I do not trust President Trump's opinion on this at all. He does not. Also, his tweets have been
very.
It actually does have an impact on people. People do take the president's word to heart a lot of the time. So.
Yeah, and also I think Mike Pence is a horrible. Mike Pence is a bad person, in my opinion, to lead the U.S. response to the coronavirus, considering how slow he was to respond and how reluctant he was to respond to the AIDS crisis in Indiana.
Yeah.
He was, very slow to, I think it was like needle exchange programs, or I forget exactly what it was, but he just did not take preventative measures to try to stop the virus, and he was criticized. That's one of the things that people criticized him a lot for in his time as governor. So, I don't think he's the best person to be leading it, and we'll see what happens. We'll see what happens with our school district too, because they're obviously making decisions, and we'll have to see what they put out. I'm sure they're monitoring this very well. I don't know at this point whether or not they're supposed to have a public meeting on the 17th of March, so that's the primary day. I don't know whether or not that's going to happen. So, and I'm assuming if they choose to have it, they might have it online, or so they might just do a video chat and do a private one. I don't know.
Yeah. So,
but I'm sure they're talking about it. They did say in the email that they were going to take the time that we're out of school to disinfect the schools. So I'm sure they're going to come out with more information as time goes on.
Ethan, so can I give my little spiel about how this is going to impact voting?
Yes. So actually, no. I'm going to restrict you from doing so.
What? Okay.
Yeah, that was a joke. For legal reasons, that was a joke.
Okay.
I want to transition, into more bigger. Well, yeah.
But more local issues.
I have a big spiel about local issues because we're just talking about the school. So the coronavirus thing is definitely impacting voting in DuPage County. Early voting numbers are not released, but everyone I know from within the political arena here says that early voting has been increased because people do not want to go on election day when there's a lot more people and a higher risk. Even though most early voting sites only have electronic. For example, I voted on Wednesday, and there was only electronic machines in the Naperville early voting site, which you could vote from anywhere in the county. Mm-hmm. So it's a little bit concerning, and it is impacting people's decisions. I will firstly say that, earlier today, I was talking to someone who was telling me that a voter in his neighborhood that he was going to drive to vote today actually decided not to vote because she's a very elderly woman who's afraid of the risk of contracting the coronavirus, especially because Elmhurst early voting site is at City Hall, and apparently there was a worker there who had been in contact with someone who had the coronavirus, so he's being tested now. So it's a little bit concerning, and I'm going to talk about some things that the county is doing to prevent this. So some other counties have also done this. There's a few elections being held on Tuesday. DuPage County and all of Illinois is voting in the Democratic and Republican primaries. There's a couple other states too. And DuPage had to take some preventative measures. There's some polling places in nursing homes and other areas where they would not want a lot of people to come due to the risk. So DuPage County actually moved 14 polling places to the county fairgrounds for Election Day. And the other big part of it is that the election judges are being increased in pay from, I think, $130 to $200.
Correct.
Which is a big deal because the DuPage County is really short of election judges, mostly in the Republican Party, because polling places need election judges of both parties. And a lot of them are backing out due to fears of the coronavirus. But polling places are taking a lot of preventative measures, a lot of extra hand sanitizer and wiping down machines and stuff like that constantly, and stuff like that. So I'll read a little bit of a statement from the DuPage Election Division from County Clerk Jean Kazmierek, who is now in charge of the Election Commission after it was merged last year. So the DuPage County Clerk's Office, after consultation with local and state agencies, is announcing a series of actions being taken to respond to the impact of COVID-19. So yeah, election judge pay is being increased from $130 to $200, and from $10 per hour to $15 per hour for early voting judges, which are the people at like Elmhurst and Naperville, the permanent and non-permanent sites. So there's been a really big loss of election judges, is what it says, and they need additional workers. So that's why they increased the pay, which is an important thing because it attracts more people to do it. Even though you need training, so they're doing some last-minute trainings. And the important thing is that no long-term care or senior living facilities will be used as election day polling locations. So there's 14 polling places that were moved to the county fairgrounds, which is a big deal. And there's a list that you can, if you want to see if your polling place was affected, you can go to www.dupageco.org/election/. And the only polling place that's closed in Elmhurst and moved to the county fairgrounds is Lexington Square, which is in Elmhurst. There's one in Lombard, Beacon Hill, Bensonville. There's Bridgeway. There's another one in Lombard, Lexington Square. So I think it's a shared location with Elmhurst or something. So there's a bunch. You should look at that website if you think your polling place might be moved and see what to do. And early voting actually ends today. This podcast won't be up today, but today we're recording this on the 14th, which is Saturday. So definitely make sure you vote. It's safe, as safe as it can be. There's preventative measures being taken, and you should make your voice heard. Just be careful with how you do it. So that's what I have to say about that. Yeah.
And I don't want to scare anybody, but I mean there's been not necessarily a confirmed case in DuPage or Elmhurst, but I just want to read off what the city of Elmhurst has stated. Verbatim. The city of Elmhurst has been notified that a city hall employee's family member was exposed to an individual with a confirmed case of COVID-19. The employee and the employee's relative are under self-quarantine at home and are not showing any signs of the virus. And the employee was at work earlier this week and did have contact with the general public during this time. The city of Elmhurst has consulted with the CDC and DuPage Health Department guidelines, which advise that the risk of contracting the virus at a third-hand exposure level is greatly reduced unless symptoms are present. The employee with third-hand exposure and the employee's family member with second-hand exposure are both asymptomatic. So if you want, there's a place on the City of Elmhurst website about COVID-19 update, and you can read more about this issue if you're interested in confirming facts. And
it's a little bit concerning because they didn't release which department the worker was in, and some people are concerned on social media that the worker could have been in early voting, which could have impacted a lot of people. So people are concerned about that.
Yeah. So anyways, stay clean, wash your hands, sanitize your hands, consistently do that. And although it may kind of hit a flat line in the summer, continue to do that, even if it dies down. And just try not to feed into that hysteria. I mean, although, yes, it is scary, be serious, be prudent.
And do not stockpile. A lot of this is being not selfish. And, the thing is, as young people especially, we have to consider that it's not really about us, it's about other people. So make sure you consistently take preventative measures to be clean. And also, there's really no point in buying out the toilet paper at Costco or all the soup at Walmart because there's no supply issues. It's just that people are being irrational. So don't be irrational. Think things through and don't freak out about it.
Confirm.
Just be careful.
Confirm facts. Make sure you get where your information. You know where your information is coming from.
Speaking of confirming facts, CNN just reported that President Trump has taken a coronavirus test.
Oh, so when are we going to learn?
It says he said he was I believe it was a press briefing. Trump said he was tested Friday night and also has his temperature taken Saturday before entering the briefing room. He said his temperature was normal, and when asked when he would announce the results, he said that the test was sent to a lab and could take a day or two. So, okay.
I guess we'll find out soon.
So I guess because he had contact with a couple people. There have been a couple people at Mar-a-Lago, his Florida resort, who have been confirmed cases, as well as I believe it was the Brazilian.
Press secretary?
Yeah, I believe it was the Brazilian press secretary who was confirmed to have coronavirus, and he had met Trump, I believe, sometime last week or 2 weeks ago.
Yeah.
So, yeah. I'm trying to make sure. And there were also people at CPAC.
Yeah, I was going to say CPAC.
Which is a conservative political conference. There were several people there that were confirmed to have it. And so some of the representatives who attended, representatives and senators have self-quarantined. So I know Ted Cruz at some point self-quarantined. And I believe Mark Meadows, who is
also
trying
Collins,
to be, he's trying to be the new chief of staff for the president. I think he also self-quarantined.
And Tom Hanks as well, the actor.
Oh yes, because he's
Tom
in
Hanks
Australia.
Actually
has confirmed has
and his wife.
COVID-19.
And his wife.
Yes.
And that's it for today. It's been the Wise Duke Podcast.
Don't freak out, guys. Just be rational.